We're going to transition to the last section, which is what did they learn? And they have on the first slide, big takeaways. They have you have to have the tools of the old ways to make it work. In other words, paper, toner, paper processes, those kind of things. You have to, because in his words, they had good processes to be down for a day. They had bad processes to be down for 30 days. And I think that's true across the board. I can't tell you that we had a good process to be down for 30 days at St. Joe's. That would have been to have the data center down, to have the primary clinical systems down for 30 days. I'm not sure many health systems do have that kind of thing in place. Let me go through the others. So there are providers who only knew the EMR, not paper, which is what we talked about. And they said there's a massive backlog of paper post outage. So they had to restore the data. They had to plan on the data that was being generated as they were down, that had to be re-entered and all that stuff. So those were three of his key findings. He talked about key findings around prevention. He said you need to have good backups, security operations center 7x24, 365. Education is first line of defense, playbook for extended outages, and plan for rapid deployment of systems. And those are pretty good. And strategic recommendations and priority. He has implement multi-factor authentication is high, continuous monitoring is high. Medium was centralized log repository. Medium was incident response team on retainer, and low was incident response plans and playbook and security awareness program. So those were the major findings. I'm sorry to go through those real quick, but as is usually the case when you and I talk, we have so much to talk about. What other learnings or what do you take away from this incident?
Some things I'd prioritize a little differently. I would tell people spend and invest time on your incident detection, response management, monitoring. That is you cannot prevent this from happening. And the CIO concludes that. What you can do is reduce the impact if you can detect and respond and recover quickly. Spend time and invest in network segmentation. They didn't talk about patch and patch management. What makes a system susceptible is they forgot to get their vaccine. And this is not political and it's not moral. Just get the vaccine and vaccine your systems. It's called patch management. You need to be doing that. I think that's so critical. Building the BCDR plan. Identity wasn't talked about heavily here, but I would tell you, I'd invest time, spend time understanding the identity. Where should this identity be used? Is it okay for Bill's, in case this lady, Susie or whatever her name, can Susie's identity be used in Russia? If we had identity management, we would have said, that's anomalous. Why is Susie's identity being used in Russia? Catch that. Even if you missed everything else, get an identity management strategy, the multi-factor strategy. Those are things I would encourage our users to take a look at.